What is the primary purpose of calibrating EKG equipment? And the thing about this question actually is that when you look at the choices, they all are referring to reasons why, or what the question thinks could be reasons why you would calibrate equipment in general. So just something to keep in mind, even though it is asking you about the EKG equipment, the answer to this question is the answer to why you would calibrate any machine. Just something to keep in mind. But now we need to understand what a calibration is. So that's something that you might have seen even in non-medical equipment. If you've ever had some sort of touchscreen device where maybe they have different dots on there and they say move your stylus toward where the dot is and mark it, just to make sure that the screen is adjusted properly so wherever you point or touch, it knows to pick it up there. And the reason it's doing that is to ensure accuracy of where you're touching. So if you're trying to do something over here, it's not picking up a line over there. Because ultimately, the goal in all medical procedures or any sort of equipment where you're getting results is safety and accuracy. And that's the overall theme of the medical assistant examination in general, is that we want safety of our patients. And in order to do that, we want accurate and efficient and good results. We want things to be real and complete, because if you have inaccurate results, then that leads to issues, and ultimately that prevents patient safety. So let's see which choice has to do with this idea of calibrating for accuracy. Option A says to extend the life of the machine. And although that is very helpful if the machine lasts longer so you could use it more and get more results, that's not focusing on the accuracy. That's focusing on how long the machine is working for. And actually, the calibration is not intended for extending the life of the machine. That would be more for batteries if we're looking at life of the machine. So we can eliminate option A. Option B says to update the software of the machine. And no, this is not used for software updating when we're doing calibration. So we can eliminate that. Option C says to change the display settings of the machine. And the calibration wouldn't be part of the display settings. That would be a different feature in the machine under maybe a settings tab if it has that. So we can eliminate that. And then that leaves us with option D, to ensure accurate and consistent readings, which is what we said we're looking for when we're calibrating any sort of equipment. So we'll go with option D for this question.